This is Pet Life Radio. Let's talk pets.
So welcome. You're live with Dr. Jeff Weber here on Pet Life Radio's Ask the Vets with Dr. Jeff, as well as my Instagram Live. We're going live today from Orlando, Florida at the VMX, and which is the Veterinary Medicine, it's what do they call it officially? It's the Veterinary Meeting and Expo.
Yeah,
and
it's a mouthful.
This is part of the NAVC, North American Veterinary Conference. And we have a great guest today, and here with me is Dr. Dana Varble.
Hi.
And Dana is a veterinarian, and that's why Dr. Dana Varble.
Of course.
And she is Chief Veterinary Officer here at the VMX and NAVC.
Correct.
And
yeah.
Anyway, so when I'm here, I like to talk about stuff that's interesting for everybody. So we're going to get right started. First of all, as you know, I like to peruse the news. Now, we are here live and coming out of Orlando, so you can't call me, but you can drop me notes. So we can get both of us in the picture. I'm going to wave as many of you as I can, and widescreen. So I may not see all your questions, but we have lots to talk about. So that's okay, because you're going to learn a lot and hopefully have some fun. So first of all, as you know, perusing the news. I like this one. And Dana's going to just chime in. We have some things to talk about. And this first one is something controversial. We already had a little conversation, so it's fun because they say difference of opinions makes horse racing. So FDA approved a new drug by its awareness. It's called Silencia. It sounds like coming from Los Angeles, everybody speaks Spanish. Silencia. So shut up. So treat arthritis pain in cats. The active ingredient. Listen to this. It's a big word. It's frunevetmab. Say it 10 times. Frunevetmab. And basically what it does is it binds to the nerve growth factor protein and blocks signals from that protein to the brain. So it blocks the pain signal, and which is great. So it's very innovative, very new, and I think that's great. So we're having to talk about, and this is where I get to sound a little cruel sometimes, and I talk to my clients about this. We know that when we hurt ourselves, we injure ourselves, we have a soft tissue injury, we have some pain, that even though we're going to take our NSAIDs, we're going to take our pain medication, we're going to take our Robaxin, we're still going to lie down and stay off of our leg or our back, whatever it is. Dogs don't know that. So what happens is, I find, is that sometimes it's not like I'm mean and cruel, not that I want it to be of course we're going to treat excruciating pain, but if there's a little bit discomfort left, I think that's what keeps them honest. And Dana doesn't think so. Dana wants to keep them. She wants to drug them up.
Well, no, you know what? I think about myself because I did sports growing up, and I'm still a very active person. So, and I'm not always the most coordinated person. And all of my colleagues in the back are laughing because I trip, I fall. I'm just sort of a silly person. And so I've had injuries, and I just think about when I've been injured, even though I'm taking, like you said, my NSAIDs, my other pain medication, whatever I'm doing at the time, I'm still sore. So even then, I still think I have enough pain to know, gosh, if I step on that, it's gonna hurt.
Right.
Still.
So you stay off it. So anyway, you know your dogs, and if if you're treating a dog for pain or a cat for pain, and with this new medication, for example, and it is, I'm going to get my hand over the screen, guys. I'm not covering you up. I'm just saying I'm waving to you. So anyway, that if you see that you're having a tough time keeping them quiet, then you might want to talk to your vet. Obviously, there may be something else you can add to it. Maybe something to sedate them a little bit, and still you're controlling the pain, but they're doing that.
Well, and I think today we have so many more options.
Right.
Not just for pain, but like what you're talking about sedation, but some of them are really just to decrease anxiety and make them a little quieter nowadays.
That can
so
help.
they're not as knocked out, which is nice because I know, like if I have big dogs, you've seen pictures of my dog, he's huge. If he's too sedate, I can't pick him up. He weighs 120 pounds. I can't move him. So for us, it's more about him being quiet, not sedate.
Right. Okay, next up. There's a conservation center near Fort Collins that celebrated a first birthday for a black-footed ferret. So what's the big deal? Here's the big deal. This ferret was cloned from a ferret, and this black-footed, the species is on the endangered list. So they cloned her from a ferret that died 35 years ago. And now she's a female, she's gonna have kids, and they're going to take those kits and send them out to the wild, and hopefully to repopulate with this genetic diversity some of this particular species. That's pretty cool. Huh?
I love this story because
Yeah.
I think it's so neat. You know, one of the things that our species suffer from is something we call a genetic bottleneck. I mean, there's just not enough genetics to like keep them healthy. So this really opens up, you know, hopefully a really good thing, a possibility of being able to add that genetic diversity back in.
Right.
And the big thing, you know, Jeff, that this helps prevent is maybe some diseases that we just they're genetics prone them to.
Absolutely.
Yeah.
Absolutely.
So really exciting story.
That's pretty good.
I'm so glad you shared that.
This one you're gonna like too. And this is the law in Texas. You know, we really like these animal welfare laws and things that are protecting our animals and really holding pet parents and owners and handlers responsible for what and how they do. And so here's one that it's a new Texas law banning the use of chain tethers, weights, or poorly fitting or constraining collars and harnesses on dogs that are left outside. And if they are left outside, they have to have shelter and large enough that they can stand, sit, turn around. And I think that's great. I mean,
I do.
Of course, the animal welfare advocates are saying, well, it's okay. I mean, of course it's okay. I mean, we need, they're worried that we're going to have, how are you going to monitor it? I mean, everybody's going to get on their phone and call them about their neighbors. So they're going to have personnel from Animal Reg driving around all the time and peeking in people's backyards. I mean, it's going to be a tough one, but at least now people are on alert.
It's a start, right? It's a good start.
It's a start.
Yeah.
We're watching it. We're going to watch it. And let's see. As I turn the paper, there's some things you want to talk about too. Oh, this is one we were talking about earlier.
Yeah.
And again, I really like these little animals, these little critters. I never had one, but Dana knows a lot more about them. Bearded dragons.
Yeah.
And all of the reptiles carry a lot of salmonella.
They do.
And apparently there were 44 cases. I'm just waving and I'm trying to keep my phone steady. So you're not drunk, it's me. So that there's salmonella. So you be very careful. There were 44 cases over 25 states. They actually had a chance to interview 33 people, 22 of which had contact with a bearded dragon just before they fell ill.
Yeah.
So that tells you.
I mean, it's something that's really important for those of us that I work with reptile pets all the time. And it's something we always tell our clients and we remind people all the time. But we have to consider that almost all reptiles potentially carry salmonella as part of their normal bacteria.
Right.
And it doesn't make them sick usually, but it can obviously make humans very, very sick. So we talked about this. The big thing, we're so good at this now after the pandemic, right? Wash your hands, good hygiene. I always talk about, and this is something I've made this mistake before myself because we're human, right? I've taken their water bowl and just gone and washed it with my regular dishes. And then afterwards been like, because you just don't know. Is there salmonella in the bowl? There could be. So you're supposed to really wash your reptile pet stuff
keep their habitats clean
separately.
Don't feed them in the kitchen. Don't prepare their food. Don't let them come in the kitchen. And as Dana just said, when you are washing, do it in the bathroom. Do it someplace where you're not going to have
or someplace you can wash. You know, that's one thing. Like sometimes I'll do
like
that
a laundry
in the
sink or
bathroom.
something.
Yeah, a laundry sink is a great place. In the summer outside. I know that sounds crazy, but in some places that's really possible. So
There's another story I love. I love when the first story came out about, we know that the dog nose is like none other. We have 5 million nasal receptors. They have 250 million. I mean, it's insane. And what they can pick up. And I mean, there's stories all the time I share with you on either Instagram or on Pet Life Radio about amazing things that dogs can do. Like recognize our expressions. They feed us. I always say dogs know us better than we know them. They really do. They're so amazing. Well, anyway, we know that they were using, especially in sports venues and large concert venues. Metallica, for example, the band, they use dogs to detect COVID-19. And they don't want anybody backstage that can obviously affect them. And there are dogs there. Well, so what's happening is that what the dogs are sensing is the protein from the virus that gets into our sweat. And so what were those dogs smelling? They were smelling, and I'm just getting all this stuff at the front door. I always forget to put do not disturb. Sorry about that. I'm not rubbing you away. And it's a sweat from our hands and our feet. But interestingly, the Omicron doesn't work the same.
Oh, bummer. Okay.
So what they're doing is it's not the airways, it's truly the bronchial part of the airways. But but that's not directly linked to the sweat.
Of course.
So what they're having these dogs do is smell the masks.
Oh,
They
wow.
have to take the masks.
Interesting.
Halitosis doesn't bother the dogs, so they don't have to worry. But
I think they have their own halitosis
yeah, right.
to conquer,
That's
right?
We
Oh
have
my
to
gosh.
worry about that a lot
yeah.
more. And trust me, for a guy who gets licked in the face by zillions, I know. I think I'm immune to it by now. I think people say, "Oh my God, his breath is terrible." I go, "I don't smell
Smells
anything."
like dog to me, right? And you're so used to it, yeah.
So anyway,
I always say veterinarians, luckily, it seems like collectively we have a very poor sense of smell.
which is a good thing.
Which is a good thing, yes. Yep.
So, except for anal glands. But anyway, that still gets me.
That still gets you.
I can walk
Fair
into
enough.
a room, yeah.
Fair enough, yeah.
So, but anyway, so what they're doing is, but the interesting thing is the dog still can sense it, even with the Omicron variant.
Oh, cool.
So that's pretty
good,
cool.
Good.
So there were some things that I know we spoke about earlier that we want to talk about. That, again, Dana coming as a chief veterinary officer, coming from a little bit more the science end of it. But these things I feel are very interesting. So you know that we treat cancer with radiation. I know when my mom had her brain cancer, they were using what we call stereotactic radiation, where they can take that radiation beam and put it exactly where it needs to go.
Isn't that cool?
Well, it's amazing. And anyway, now that's being done in animals.
Yeah.
So apparently there's a talk here about it.
Yeah, there's a talk about it. What's cool about it is it's tiny, the radiation and the side effects of the radiation, doses go down, it's easier for pets, it's easier for their owners, the folks that love them, to actually get this treatment now. So what a cool thing.
So basically by being able to direct the beam directly at the mass, you're not getting scatter.
Yeah.
It's so focused, and I think that's really, really cool. And again, we talk about safety issues.
Absolutely.
It's safer for the animals, and it's safer for those around.
Safer for us
Exactly.
too. Safer for the folks
So
that are
good.
treating them, which is awesome.
Another thing that again we sort of don't put a lot of attention in, we haven't, and now it's becoming more of an issue because it's being done by, as we like to say now, veterinary nurses. We should talk about that. What is going on here at NAVC?
Well, we're really excited because we have some big announcements coming up that we're really, really focused on making sure that you guys understand what veterinary nurses, veterinary technicians do.
Right. That
it is a profession, that they had to go to school, that they have a ton of experience, that they have a ton of expertise.
It's like an RN.
It is,
right.
Yeah. We really want to position them. They are the RNs for animals.
Right.
Yeah.
And the interesting is they being the nurses, the veterinary technicians. When you talk about your computer and you talk about the repair person, what do you call them?
A
technician.
Yeah.
So there's a lot of talk within the industry. Wait a second. The veterinarian, we're doctors, just like the human doctors, and the dentists, we're doctors. Why are the nurses called technicians?
Yeah.
Where they're doing the same thing.
It's an old term. I mean,
Right.
but I understand too. I mean, some of our veterinary technicians worked really, really hard to get their titles and their credentials,
absolutely.
and that's awesome. But when you say veterinary nurse, everyone
Everybody gets
understands
it. They get it.
right? They
100%
get
they get
it.
it.
Yeah.
So
we know what nurses do.
Right, so I'm going to wave to a few of you. Oh, by the way, thanks for joining me. Now, I'm not, because my phone, so I can get me and Dana here, which it's sort of angled differently. I can't see any of your questions, so I will review this afterwards and obviously get back to you. Or you can always get a hold of me directly to talk about anything you want me to talk about. As you know how to find me, Werbs_DVM. Just put in Dr. Jeff Werber. It'll come, trust me. All right, next up. So, what we're talking about nurses, apparently now, neonatal care for puppies and kittens is becoming something that's, we never thought about this.
I know.
And now it's really.
We just kind of, dogs and kittens have puppies.
Yeah.
We just kind of did this, right?
Right.
We hope for the best.
Right.
Yeah. But especially, because we are paying more attention. So those puppies and kittens that are born, we really do need our veterinary nurses to be super educated on how to take care of them because we want that great neonatal care so that they can make it and be all our wonderful.
Well, think about this. As you know, I do a lot of French bulldogs. I see hundreds of Frenchies in my practice, and most Frenchies also need to have C-sections.
Yes.
And again, working with a veterinary nurse, veterinary tech, who understands what to do. Because there I am. I'm pulling them. I mean,
our hands are full.
Yeah,
our hands are full.
Some litters as much as 10 puppies.
Yeah.
And I mean, they have to know how to get these, how to check them out, how to get them breathing, how to do the rocking.
Scoop.
Right, the scoop, exactly. Like I say, it's like an underhanded softball. And how to hold them and this is not something.
How to get them heat and nutrition, and do they need it right away? And so their education in that area means so much to us because then we don't have to worry, right?
And again, in a lot of states, for example, are RVTs right now, registered veterinary technicians, like back home, I can finish a major surgery. I'm waiting for my next one. They're bugging me, Doc, we got to get going, right? He's under anesthesia. I can have my technician close the wound, close the skin.
Yep.
They're allowed to do it in California.
Absolutely.
How about dental extractions? They're allowed to do it in California. So we rely so much on them. As long as we're right there, we have to be what we call under direct supervision.
Absolutely.
And yet they're so talented. And quite frankly, when I started as a veterinary nurse technician, way back, right? What we were doing, we were cleaning cages, doing fecals, giving shots, not even giving shots, preparing the injections, right?
Yeah. Still important work, but that's what the assistants do.
Right.
These folks are educated. They don't need to be doing stuff like cleaning cages. They need to be administering those shots and helping us calculate fluid doses.
And doing what we call TPRs.
Nursing care. Telling us if something's wrong with a patient. We can't be there with all of our patients in the hospital, but our nurses can. Veterinary nurses can.
So that's great. So we're going to be hearing a lot more about veterinary nurses. And just so you know out there that, people ask me all the time, so Doc, you're going to be doing that dentistry, right? You're going to be doing it. I said, well, we do the anesthesia, but I have my dental techs have done more dentistry than I do.
Oh, far more. I have no business doing them. They're so talented too. Why would I let I've told people, I'm like, you don't, like, I'm flattered, but you don't want me to do that.
Well,
my
think about it
techs
this way.
are much better.
Who's cleaning your teeth? Is the dentist cleaning your teeth, or is the dental hygienist?
Yeah, exactly. Same thing. And
exactly.
You want that person with the most expertise doing the thing that they're most qualified to do.
And who enjoy doing that, because they went through all this program, this schooling. They have to get licensed. It's a 2-year program in many states.
Yep.
And
some places 4.
Really?
Yeah.
Oh, wow.
Because you can get a bachelor's degree now.
Oh, you see, that's
really cool.
Now you're teaching an old dog new things. So
well, we try.
Yeah, right.
We try.
So that's really cool. All right. Next up, CPR.
Yeah.
And so apparently there's some new things going on in CPR.
So most of us at home, you guys have heard of like the Red Cross CPR classes.
Right.
And it's really interesting because if you take a Red Cross CPR class, you're not just certified in CPR, but you know the rules, right? How often to press, what to do in what order. Well, for the longest time, we didn't have that with dogs and cats.
Right.
We knew it. We got trained in it in vet school,
right.
And we did it. And there was some rules.
They taught us a little bit about the Heimlich maneuver thing.
Yeah.
Like that. It's choking, right?
Yeah. Well, now there's a CPR course for animals called Recover, and it's really great because now it puts all those. It kind of takes the Red Cross model and makes it available for animals, so that we can be more consistent and have better results.
Now, is this something that pet parents, owners have access to or can have access to as well?
Both. So it's for professionals like us to standardize CPR in a hospital setting, but I do know that Recover has some information out there for pet owners too.
Okay.
So that's really important because, of course, just like CPR in people, the sooner that it gets started, the better chance we have.
Right. So now you mentioned earlier that you see a lot of reptiles.
I do.
So you do a lot of exotics?
I do. I work at a clinic that does not do dogs and cats actually now.
Really?
Yes, as well as my job here at NABC. Yeah. Yes. So we see everything.
Like?
Everything
Tell
else.
us some good stories.
So I just saw a duck.
Okay.
And unfortunately, the duck had a run-in with a raccoon.
Oh.
And it's a little scary because ducks and this is a big duck.
Yeah.
And I don't know what this raccoon was thinking because there's no way this raccoon was going to win this fight. But the raccoon went off and the duck unfortunately had a very big wound. So we've been working really hard with this duck and his wonderful, super devoted owner who just is attached, loves her duck. So I'm getting weekly pictures and I'll have to show them to Dr. Jeff afterwards because every week I'm seeing this wound get better and shrink and the infection's resolved, and so I'm thrilled.
And do you guys do big cats too?
We do not because they're fun. Yeah. But in the state of Illinois where I'm at, that is a USDA.
Gotcha.
They're very regulated.
Now it's so funny because years and years ago, let's go back in the late '80s. I was at one of the conferences and they had a whole day on populated pigs and they were just getting popular. I said, you know what?
Still see.
And you said so.
Absolutely.
I saw. Wait. So I saw one pot-bellied pig. After all this, I had a whole day. I mean, literally, I was so ready to go. I knew it, right? So one comes in, and it was a Latin family in Los Angeles, and they also had a dog I took care of.
Great.
And I saw the popular pig. It was really cute, fun. Anyway, about a year goes by, maybe a year and a half.
Okay.
I'm sitting there with the dog, and I finally say, he said, whatever happened to that popular pig? Oh, hell, Doc, he got way too big.
Oh, no.
We ate it.
Oh, my goodness.
Said,
No, I've not seen that. Oh, my gosh.
Your pet?
No.
But I guess for a large animal, we know.
I was gonna say that sounds like a large animal. I don't see any of my potbelly pig owners who love and adore their pets going that route.
My oldest daughter Ronna just got 8 months ago got a mini golden doodle.
Oh,
this thing is the cutest thing on the picture. I should post the pictures. Well, that mini doodle who was just in the other day, right, 8 months old, is.
I know what he's going to say.
46 pounds.
Not as many as she was hoping.
Right, and he's as tall as my yellow lab.
Oh boy.
And he's not done growing yet.
Oh no, that's just the beginning.
So cute.
That does happen with some potbelly pigs quite a bit.
Yeah. But you have to understand, when you think of genes, okay, you have these crosses, all right, and you have a lot of doodle crosses, but you have a golden. I had a labradoodle. I was one of the first. He passed about 6-7 years ago, and I had him before. I had him 20 years ago. All right, good old Pierce. And but when the genes come from the parents, it's not like they blend each gene. No, you're going to get that gene from that, then you're going to get that gene, and you never know.
Never know. Yeah.
Well, clearly, the growth gene came from the golden retriever. So
sometimes they do, right? Sometimes they do.
And when you have like what we call an F1, which is the first generation, it's that whole gene. And anyway, look, he is so much fun and he's so cute.
That's all that matters.
But that's all that matters. And the kids, my grandkids love him, and he's so sweet. But no, so that's when you talk about these dogs, these animals, they can get too big. Mm-hmm. That's why. I mean, I don't know. How did they breed originally populated pigs? Did they breed them down?
Well, they're a smaller version of a pig, and in other countries they tend to have smaller pigs than we have in the U.S.
Right.
So it's been a combination of things that have bred down the genetics of these pigs to be quite small. So most of the ones that we see are actually well into their generations, and typically there's when we say potbellied or mini pigs. Right. I still want to. I'll preface this. Mini pigs are still usually 60, 70 pounds. They're not tiny pigs, but they're still quite small, manageable.
And how about the mini horses?
I do not see those. Those go with their horse vats. Thank goodness.
Yeah.
Yes, because that's a literal. I joke. This is a bad joke. They're a horse of a different color. That's not what we see. But,
So the most I don't really do exotics. I was you learn about it in vet school.
Of course.
I have two of my classmates that are zoo vets right now.
Wonderful.
But the greatest case I had, actually, it didn't turn out well once we found out what it was, but doing it was great. And that was, I got to work on, the huge goldfish, right? The koi.
The koi. Yes.
So,
beautiful
and koi
creatures.
and very expensive.
Very expensive.
So here's this koi. It was brought to me. I said, well, koi, it had a mass, and no one knew it. So I read up on it. It was really cool when I think about what I did. And I didn't even know if it was right or wrong, but it worked. And that is, I took, when you go to a restaurant and they're bussing your table?
Yeah.
Okay, they have those big gray,
bits.
So we filled it with water up halfway, took the anesthetic gas and put it into the water.
That's one way to do it,
And put this fish in the water.
Yep.
We then had to pluck, it's really hard to cut through the scales. So we had to pluck the scales, and enough that I could make an incision, made an incision, and found out, unfortunately, that this fish had a tumor in its liver. All right. I removed the lobe of the liver, sewed up the fish.
Yeah.
All right. And it lived. It was new, but it lived for another month.
Good.
But that was pretty cool.
You know what? I just did surgery on one of my own fish last year.
Did you really?
Yeah, for the same thing. Yeah, we did a tumor removal on one of my cichlid fish.
Really?
So and the fun thing about that is, I work in a clinic with a very small CT machine. So not only did I get to do surgery, I actually have a CT of my own fish.
That is so cool.
It was really fun because I got to plan the surgery better because of that additional information.
Right.
Yeah, it was really fun.
Well, they were talking about now. I reported on this a couple weeks ago about doing CTs now prior to some of these surgeries. And what they did was they did a CT. They were doing 3D. So the copying, what do they call it? With the where they do now models.
Oh yeah, they can create a 3D model.
Right.
Cool, yeah.
And they use that, and by doing CTs and seeing, they were able to measure how fast this animal was a young dog, or young was a wild animal, it was an animal, it was growing.
Cool.
It was a calf, I think.
Okay.
And then they were fitting it with this 3D model.
Oh, neat.
And it was
That
so
is
cool.
so cool, yeah. And who knew we would be able to do that in a regular
well, the whole
clinic?
thing 3D. I mean, you know what they're talking about now? They're talking about being able to remanufacture organs.
Oh, I know. Isn't that crazy?
You know, and
You of course saw the pig transplant to human.
right. Yeah. Well, yeah.
Who knew, right?
Right.
Mind blown, yeah.
Well, they use, and also even pig valves.
Yes,
for
big valves for
heart
people,
surgery.
yeah.
No, so that stuff is amazing.
Mhm.
I have really cool cases to share. I'm going to post pictures. Unfortunately, it was such an emergency that I really didn't get to do. I mean, I wasn't thinking at the time I should get a pre-picture of this.
Oh,
all right.
we all forget
again,
when it's really fun.
Right.
We get so
Oh, my
involved. You
God.
forget,
I
right?
do.
Oh,
So
gosh.
anyway, it was a friend. She came in, HBC, hit by a car,
Oh, goodness.
and had a proptost eye. That means his eye, besides having some beat up around the face, it hit him in the head. His eye was literally popped out.
Oh, ouch.
And that's an emergency. You got to get to it really quickly, because you have a number of things to be concerned about, and you don't know, unfortunately, right away. And that is, number one is the optic nerve, and number two are the orbicularis muscles, which control the eye going right, left, up, down. So you have to reduce it as fast as you can. Very tough to do sometimes. Plus, because the lid now is cinched behind the eye,
Swollen,
so you got and it gets swollen, right?
uncomfortable.
So anyway, I was able to reduce it, and I did
Good.
a third eyelid flap,
Yep.
and then a temporary transorrhaphy. So you take the third eyelid, you hold it up, all right, you sew it up, then you close the lid, which is called the temporary transorrhaphy. You leave a little bit of the inside open at the medial canthus, so you can still administer the drugs.
Yeah.
And the dog just came in after a week. I'm not taking the stitches out yet. It's unbelievable.
Good.
The eye you can see is moving around behind the lid.
That's the best,
Isn't that
isn't
great?
it?
So we don't know if we have vision yet,
No.
but at least
It'll keep
healed.
its eye,
It'll
yeah.
keep its eye.
Those can be really satisfying.
Oh my God, those are the best.
One of my favorite cases was actually one of those, and part of it was that it was just like you could see it was healing, it was successful, but I'm not gonna lie, part of it was because it was a Chihuahua named Pickles.
Oh, really?
And I just loved him. I just loved his name. It was awesome. I'm like, who has a Chihuahua named Pickle? It was great.
So this it's so cool. And when you do those kind of surgeries and you see the result, it is so rewarding. As a veterinarian, it's so rewarding. I remember I had because I see a lot of bulldogs, I do cleft palate surgery.
Mm-hmm.
And when you have the split lip, right? And I have pre and post pictures also that I have.
Cool. Those are fun.
Oh, it is so much fun.
So rewarding, right?
And when you think about literally where you can see your result, and it is like you said, it's so rewarding to put these animals back together and do great. So let me. I'm going to put the phone this way for a second because I want to see if there are any questions that we can really talk about. I waved at a lot of people. Hello, hello, hello. And I got my sister there. I got my other sister there. Okay. Oh, look. So this one was trained in CPR. My groomers held a class with the Red Cross. That's great.
Awesome.
We love that. We love that.
Very cool.
And I'm all these wave. Yeah. Yes, we are trying with that story about the.
I was gonna say,
great.
I think somebody's just excited that we're doing more for those newborn puppies and
Ah,
kittens.
New York Yankee.
Thank you.
Should be
Support
called
for
Veterinary
Veterinary Nurses.
No,
I love that.
I agree because when you say that when you tell a pet parent about, well, I'm going to have my techs do it, they go, but no, I don't need to fix your computer.
Well, yeah.
I need to work on my animal.
I need you to work on my animal. Yeah.
And nurses really do say
it's just
so,
people,
and
everyone knows what a nurse does and gets it, right?
Okay, let's see. Let's see. I love when other vets join me. Thanks, guys. Dream to become a vet, to study zoology. Just hearing you guys speak about it motivates me. That's great.
Isn't it? I studied zoology.
Well,
keep
me
going,
too. I was
keep
a
going.
major. I was a major.
That's the way to go.
When I think
just
about
gonna lean in because I'm
yeah,
so excited. Yeah.
So I was a zoo major. In fact, where I was at Berkeley as an undergrad, they don't have zoo anymore. They just incorporate it to biology.
Biology.
Yeah. But I was like one of the last few zoo majors coming out of Berkeley. But I will tell you that, and I'm hoping that Dana shares this sentiment. and that is that, and I tell people this all the time, when you, whatever their profession is, if you can find something to do that you don't consider it work, it's your vocation and your avocation at the same time.
Yeah.
It's your hobby as well. As I said, veterinary medicine for me is golf.
Yeah.
Because I do it on my spare time. I could do it, and I love it.
Yeah.
And after I'm in my 38th year.
Yeah.
And I always joke. It sounds so corny. Sorry for being corny, but
it's okay.
I have not worked a day in my life.
Yeah.
And so
That's
when
awesome.
so whatever, and I lecture at my old high school, and they have a career day, and obviously I come in and I talk about veterinary medicine, and I will say this. Let me go a little farther away.
Lean in a
There
little.
we go. So that I tell the students, I used to glorify veterinary medicine, and it deserves to be glorified. However, what good for the goose, not always good for the gander. No, cancel, we're not stopping. So
We're still here.
We're still here. So, and that is that that I realized from the number of, I don't know, are you in touch with anyone from your high school class?
Yeah.
I do a lot. So,
yeah.
how many future veterinarians came out of your high school? Do you know?
Oh, I'd have to think back. For sure, me.
Oh, right.
Because I already knew.
Right.
I was one of those. I can't recall.
Right. So
yeah.
from my older sister to my youngest brother, all right, Scan, from starting high school in '66 to graduating my little brother in '75, there were 4 veterinarians.
Yeah.
Out of a couple of
Thousands of students.
Right.
Yeah.
So, the truth is, even though a lot of kids want to be veterinarians,
Yeah.
reality is when you find out how much work,
Yeah.
how much time, how much work you have to put in before you even apply to vet school, how many hours you have to have.
It's a lot.
It's a lot.
But it's a career of passion,
Oh,
right?
exactly. It's a
You
career of passion.
do it because
So
you want to be a veterinarian. There's no other reason to do it. That's
Right.
the reason.
Right.
Yeah.
So I now let them know that I'm going to be equally as satisfied at the end of our session today if I talk you out of veterinary medicine as much as I talk you into it. Because I don't want them to learn about how tough it is and to give it up after they've done all this work, gotten to college, and then find out they have to get pretty much straight A's.
Yeah.
Right? And it's really tough to get to vet school. And then say, oh, I can't do this. If I wanted to learn now, as you're
And do
17
something
or
else
18.
that you love. There's
Of course.
so many great,
Right.
there's so many great options.
So when we see someone who says this is your dream to become a vet and study Zoe, yes, go for it. It's a lot
Check
of work.
it out, yeah.
Check it out, but
Yeah.
it is doable. Clearly, it's doable because you got 2 sitting right here.
Absolutely.
So,
Yep.
All right. Anyway, thanks for joining me here on both on Pet Life Radio and live on my Instagram. This will be posted. So if you have any questions directly for me, you know how to get a hold of me, and we'll kind of go from there. And I know Dana has a lot of work to do here at VMX.
I do. It's great to talk to you, though.
Great talking to you too.
Have a great time.
So again, thanks for joining me, and we will see you here. Next week I will be in air going to the Colorado Vet Med Association SCICE, which is Ski CE, Crested View.
Fun.
So next Sunday we will not be here, but we will be here the entire month of February. I have nothing planned, and pretty much March as well. I'll be at WVC, Western Vet Conference. I usually go on Sunday, but I may do another live show from there as well. So we'll see as we get closer. Anyway, thanks for joining me, and have a great weekend. I should say, have a great week, everybody. And I will see you not next week, but the week after. And until then, be well.
Bye.
Thanks for joining me.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.